Good evening. I'm Dr. CHANDANA JAYASUNDARA. I'm a consultant obstetrician and gynecologist at Disosa Hospital for Women, Colombo, and a senior lecturer in obstetrics and gynecology at University of Colombo. So today I would like to talk a very common topic that our parents come up with their daughters and young adults and young girls actually having irregular periods. So why do we get irregular periods? Do we need to meet a doctor for that? Well, you don't have to meet a doctor for almost all the time that when you get an irregular periods. So periods normally happens every 28 days for females, and that is the norm, and we expect that to happen. But then again, in and above, we see girls coming and telling they hardly get their periods on the day, or maybe it gets prolonged more than that. Maybe it goes into 2 months, even 48 days, something like that. And or some girls might come and tell that you are getting your periods much frequently, maybe twice a month and like that. Okay, so these are the common presentations, and first they will be worried whether it will affect their pregnancy in the future or something that affect them for life. So what sort of instances that will give rise to irregular periods? Well, first thing, if your body weight changes than the normal body weight that you should have, then your periods can get irregular. So basically, if you are too obese, if you have a lot of fat compared to the amount of muscles in your body, you can get irregular periods. So in that sense, or if you are very thin, then also you can get irregular periods. So if you have irregular periods, and if you are obese or if you are very thin, rather than going and meeting a doctor straight away, it's much prudent, I believe, you reduce your weight, or if you are underweight, increase your weight and see, because that might solve the problem and it's going to be okay. Other thing is too much stress. Maybe when you are closing to your exams, when you are having some difficulties in your life, a stressful situation definitely will reduce the chances of a girl ovulating, and that also will ultimately give rise to irregular periods. So if you are under stress, it is good that you think about your situation and try to make it under control rather than just going and meeting the doctor to get your periods regular. Other thing is, there can be, if you're an athlete, if you do a lot of sports, still this might be a very normal situation for girls to not to get regular periods. So if you are doing sports, you don't need to go and meet the doctor to say that your periods are irregular. They might be normal. But what are the instances that you might have to go and meet a doctor? Well, additional to getting irregular periods, if you are getting increased hair growth, if you are getting darkening of your skin in your face, in your flexures and underneath your legs and like that, then you have to go and meet a doctor. It might be a situation where you are having a hormonal imbalance. It's called polycystic ovarian syndrome. And then if you are having very irregular periods which are not getting prolonged, if they are getting totally not coming for a long time, more than 3 months, then that might be a situation where there might be a problem inside the uterus or maybe in the ovaries. So you might have to go and meet a doctor in that sense. So what does a doctor do when you go and meet a doctor when you get irregular periods? Well, he might get a nice history. He'll try to ask some questions and try to figure out whether these are normal things that you're not getting the periods very well, or is there any abnormality. And he might do some tests, including a scan to see especially the ovaries, which we check some features in the ovaries that will give rise to a clue that you are not ovulating properly. All in all, sometimes you have to understand our periods are not meant to be regular sometimes. So some girls will not ovulate regularly even though their body weight is okay, even though their body weight is not high or not even very low, and there are no other features, still they might have a little bit of irregular periods. And if all the other things are normal, then we can carry on with our life. We must not think about it that much. Other thing is, once in a while, if we have every cycle regular periods, and once in a while we get irregular periods, still in that sense also you don't have to worry, you don't have to go and rush and meet a doctor, why is it happening. But if it is recurrent, if it's coming back again and again, then you have to go and meet a doctor to see why you are getting irregular periods. So thank you. So we will discuss with another topic that is important to you very soon.